Chronic obstructive pulmonary disease, COPD, and cystic fibrosis, CF, are two serious respiratory conditions that affect the lungs' ability to function properly. While both diseases impair breathing and cause chronic lung problems, they differ significantly in their causes, symptoms, progression, and treatments. COPD is commonly associated with environmental factors such as smoking, whereas cystic fibrosis is a genetic disorder. This article explores both diseases in detail, focusing on their causes, symptoms, diagnosis, treatments, and prognosis. Chronic obstructive pulmonary disease, COPD. What is COPD? Chronic obstructive pulmonary disease, COPD, is a progressive lung disease that causes obstructed airflow, making it difficult to breathe. It is a combination of two main conditions: chronic bronchitis, inflammation of the bronchial tubes, leading to mucus buildup and persistent cough. Emphysema, damage to the alveoli, air sacs, reducing oxygen exchange in the lungs. Causes of COPD. COPD is primarily caused by long-term exposure to lung irritants, with smoking being the leading factor. Other causes include exposure to air pollution and chemical fumes, long-term exposure to second-hand smoke, genetic factors, alpha-1 antitrypsin deficiency, frequent respiratory infections. Symptoms of COPD. The symptoms of COPD develop slowly and worsen over time. Common symptoms include shortness of breath, especially during physical activities, chronic cough with mucus, smoker's cough, wheezing and chest tightness, frequent respiratory infections, fatigue and reduced exercise tolerance. Diagnosis of COPD. COPD is diagnosed using various tests, including pulmonary function tests, PFTs measures lung capacity and airflow. Spirometry, determines the degree of airflow obstruction. Chest X-ray or CT scan, helps detect lung damage. Arterial blood gas test, measures oxygen and carbon dioxide levels in the blood. Treatment of COPD. While there is no cure for COPD, treatments can manage symptoms and slow disease progression. Medications. Bronchodilators to relax lung muscles. Inhaled corticosteroids to reduce inflammation. Antibiotics to treat infections. Oxygen therapy, helps with low blood oxygen levels. Pulmonary rehabilitation, includes exercise, nutrition, and counseling. Lifestyle changes. Quitting smoking. Avoiding lung irritants. Engaging in regular exercise. Prognosis of COPD. COPD is a progressive disease, meaning symptoms worsen over time. However, early diagnosis and treatment can improve quality of life and slow its progression. Cystic fibrosis, CF. What is cystic fibrosis? Cystic fibrosis is a genetic disorder that affects the respiratory and digestive systems by producing thick, sticky mucus that clogs airways and obstructs the pancreas. It is caused by a mutation in the CFTR, cystic fibrosis transmembrane conductance regulator, gene. Causes of cystic fibrosis. CF is an inherited disease, meaning both parents must carry a defective CFTR gene for a child to develop the condition. The defective CFTR gene disrupts the movement of salt and water in and out of cells, leading to thick mucus buildup. Symptoms of cystic fibrosis. The symptoms of CF vary in severity but typically include persistent cough with thick mucus, frequent lung infections, example pneumonia, shortness of breath and wheezing, poor weight gain despite a healthy appetite, salty tasting skin, digestive issues, including greasy stools and malnutrition. Diagnosis of cystic fibrosis. CF is usually diagnosed in infancy through newborn screening. Other tests include sweat test, measures the amount of salt in sweat, as CF patients have higher salt levels. Genetic testing, identifies CFTR gene mutations. Lung function tests, Assess breathing capability. X-rays and CT scans detect lung damage. Treatment of cystic fibrosis. There is no cure for CF, but treatments help manage symptoms and improve life expectancy. Treatments include airway clearance techniques, helps remove thick mucus from the lungs. Medications. Bronchodilators to open airways. Mucolytics to thin mucus. CFTR modulators to improve CFTR protein function. Antibiotics to prevent infections. Nutritional support, high-calorie diets and pancreatic enzyme supplements. Lung transplant, for severe cases when lung function is critically low. Prognosis of cystic fibrosis. Advancements in CF treatments have significantly increased life expectancy. Many patients now live into their 40s or 50s, whereas in the past, CF was often fatal in childhood. Conclusion. Both COPD and cystic fibrosis are chronic lung diseases that cause breathing difficulties, but their origins and progression are distinct. COPD is mainly caused by environmental factors like smoking, whereas CF is a genetic disorder affecting multiple organs. While both conditions require lifelong management, medical advancements have improved outcomes for patients. Early detection, lifestyle modifications, and proper treatment can help those affected lead longer, healthier lives.
Thank you for watching. Please subscribe our channel.